In this video, we're going to talk about the beginning of the helping process, the initial or first session. Counseling is an art form. There's a certain air of mystery that surrounds therapeutic sessions such as counseling and psychotherapy. A lot of people think that this form of one-on-one therapy will leave them feeling exposed and uncomfortable, and others assume that confidence will not be strictly maintained. There are a lot of fears associated with starting the counseling process. There are many different counseling approaches and disciplines available, and there are strict guidelines that a counselor or other therapeutic professional must adhere to at all times. At the start of every counseling relationship, some form of client assessment must be made. This evaluation may be done by an intake specialist or by the counselor during the first appointment or over a number of arranged sessions. The reason for this evaluation is to allow the counselor the opportunity to clearly understand the problems the client wishes to address in therapy and how they wish to improve. Once a counselor has been able to evaluate the client and present the presented issues and problems, the counselor will be able to allocate an agreed time for subsequent counseling appointments. The counselor will also be more equipped to help the client set appropriate goals. It is common for both the client and the counselor to feel anxious or apprehensive before starting the counseling process. What matters most is if the client gets to talk and truly be heard. This begins to develop professional relationship with the client, a strong rapport, and eventually decrease their anxiety and help them feel more comfortable. First impressions really are long-lasting. It's important to be timely and friendly. Greet the client warmly, smile and shake hands, and escort the client to your office or the appropriate therapeutic room. You can offer them a chair and a drink of water if you'd like. Initial sessions are hard because your client will be nervous, not knowing what to expect, especially if it's their first time in counseling. There is much variability in the counseling process. However, the initial session is one of the sessions that is the most structured. There's no one right way to do counseling or therapy. However, there are some things that we need to avoid and some strict guidelines that we need to follow in order to adhere to ethical codes and guidelines set for the profession. Each person that we work with is different, and each counselor also has a different approach and different personality. This makes for each counseling relationship to be unique. There are also various types of counseling, such as group counseling, individual counseling, family counseling, and different types of counseling approaches, such as wilderness therapy, sports counseling, substance abuse counseling, all with a specific focus or set of skills associated with it. Additionally, there are various settings that counseling takes place in. It can take place inpatient, where clients are living in the facility where they are receiving counseling services, outpatient, where clients come in from the outside in order to attend services, in-home services, where counselors go into the homes of clients to provide counseling or other types of services, or in a school setting where counselors are working in the school during a typical school day. Finally, there's a lot of variability in the length of counseling, both the time frame that it's taking place. Is it 30 minutes? Is it 1 hour, 2 hours, 3 hours? And this varies a lot based on the type of counseling and the setting. So for example, a group that meets every other week may meet for 3 hours with some breaks in between. Whereas a school counselor might only meet with a student for 20 to 30 minutes. Also, the length of counseling refers to how long the person is in counseling or therapy. And this ranges based on client's need and what services are available to them for what period of time. Sometimes there are restrictions on the length, the amount of sessions that individuals can have. And there are also variations in interventions based on the client's need and the assessment. The first session is extremely important because we're setting the tone for the counseling relationship. The physical environment may not seem like a big deal, however, it is extremely important to set the client at ease. The environment should be quiet, clean, uncluttered, and have soft lighting. It's also suggested that there are multiple points of lighting in the room. So typically this happens in a type of triangular pattern. The picture on screen shows 2 of the lights, and where we are sitting watching the screen could be the 3rd light, which would make for a triangle pattern. It's also important that the chairs are comfortable and that they're about the same types of chairs and the same height. The subtleties in the room or in the counseling relationship are important. Say, for example, the height of the chairs. If your chair is higher than the client's chair, that contributes to the amount of power that you have in the relationship. And we really want to equal out the power in the counseling relationship as much as possible. It's important that you have no interruptions, including no phone calls or people knocking at the door. Sometimes a sign on the door helps that there's a session in progress so that people will not interrupt. It's really important to expect discomfort at first. You may be a little anxious starting out, and the client will definitely be anxious, especially if it's their first time in counseling. To address the discomfort, sometimes it's just a matter of talking about it, bringing it up and being transparent about it. You, as the counselor, will talk more during the first session than any other session. There are a lot of things that need to happen up front in order to help set the tone for the rest of the counseling sessions. So during the first session, we are structuring the helping process so that clients have clear expectations of what they're getting into. We go over paperwork that outlines their right to privacy and confidentiality, as well as expectations both of what they should expect from us and what their responsibilities are as a client. We talk about the nature of the counseling process and how it can be challenging and difficult at times, the limits of counseling, say, for example, someone has a problem that they're dealing with that requires medication, a licensed counselor cannot prescribe medication, so that's a limit of counseling. And so clients would need to understand that if medication is something that they would need a referral to see a psychiatrist. We also set some initial goals of counseling. What does the client hope to get out of this counseling process? Laying all this out there and structuring the helping process helps to relieve apprehension and put the client at ease. It also helps to establish boundaries, both to protect yourself and to protect the client. Also, it sets a clear expectation of the type of communication that you're going to have moving forward, that it's open, honest, upfront, and straightforward. Your initial introduction, your opening remarks, should be standard and rehearsed. They should be about the same from client to client. You will want to disclose your credentials and your training. You want to explain the counseling process and something to expect. You also want to explain the logistics, meaning the frequency of your sessions, how long are the sessions going to last, is the location going to be the same every time, are you going to meet in the same office, and what does the process look like? Do they have to sit in the waiting room? Do they have to check in at the front desk? So what does the process look like? Policies surrounding payment, cancellations, or scheduling and changing appointments also needs to be addressed up front. Toward the end of the first session, you'll start to get in the exploration of the client's expectations and goals for counseling. Confidentiality and informed consent is one of the most important parts of the initial session. The informed consent document is one that describes such issues as the nature of the helping process, confidentiality, and administrative matters. Confidentiality is the obligation of helpers not to reveal client information to other people. However, there are limitations to confidentiality that will also be outlined in the informed consent. These limitations are threatening to seriously harm yourself or someone else, disclosing abuse or neglect of a vulnerable population, such as a child, elderly, or disabled person. And the third limitation is through court order, where a judge would mandate that you release your files or testify in court regarding this person and their mental health background. Finally, some general notes about the initial session. We want to instill hope, and we want to show gratitude for the client's willingness to show up. A lot of times, clients will call and make an appointment and not follow through with showing up for the first appointment. This is pretty common because their fear feels overwhelming. So if they make it to the first session, that is awesome. And to give them some praise for doing that, even though it was hard, will help to develop a strong relationship with the client. We also need to give clients permission, in a way, to share their concerns or feelings. Sometimes sharing things with a complete stranger seems weird at first, but we need to normalize their discomfort, anxiety, and fear. We also need to expect some initial resistance. The clients may not be completely forthcoming from the onset of counseling. We need to be okay as the counselor with letting the process unfold organically. And finally, we need to practice skillful time management. If the counseling session is supposed to last 50 minutes, then the counseling session should last 50 minutes. It's important that the room is set up in a way that you have a direct line to a clock, preferably a digital clock, and that you can take a quick glance away from the client to look at the clock, but the client shouldn't have access to a clock because what we find is that clients will worry about disclosing things. It'll get to be about the halfway mark or the 40-minute mark, and they'll kind of clam up because they feel like they don't have enough time left. And so it's helpful to just take that kind of anxiety off of the client, and you as the counselor need to be responsible for the time management. At about the 5-minute mark, you'll want to find a gentle way to interrupt the client or find an opening so that you can give warning that the session is coming to an end. It is an important boundary to begin sessions on time and to end on time. Overall, the initial session may seem a bit intimidating to you now, but I'm going to have you work on developing your own initial statement, and you'll rehearse that so that you feel more and more comfortable with what needs to be said in the initial session.